next group of our diseases. The name of the group is sexually transmitted infection groups. And you have informed about this group of diseases when we presented you the diseases such as scabies, such as herpes progenitalis, such as candidiasis, and a few from them. And we indicate that these diseases are transmissible by the sexual intercourse. And we wait that this group of diseases is very important, will be important for you because you will have contact with these diseases at the chairs of infection diseases, at the chair of urology, surgery, obstetrics and gynecology, and that's why it's very important part of our specialty. But I'm sure that you are informed about the diseases group, and the name of this group is venereal disease. And that's why it's important to differ these two terms, such as sexually transmitted infections and venereal disease. What is the basis of their difference between these two groups? The group of venereal disease, this group, venereal diseases, we can include in the group of sexually transmitted infection group. And why this group is important for the human population? I'm sure that in your countries, such as in my country and in our country and in other countries, the purpose of governments of country is stability of ethnical group of population. And that's why we know the group of diseases which are importance in the strategy of medical organization. We can include in this group diabetes mellitus. We can include arterial blood tension, oncogenic diseases, oncology diseases, then psychiatry. We can include HIV and this group of sexually transmitted infections groups. Why? Because I repeat that purpose of the medical organization and medical strategy in your countries, in our country, is purpose to have the constantly ethnical group of the population. And because these diseases sometimes are the basis of formation of infertility of persons. And the diseases such as gonorrhea, chlamydiasis, mycoplasmosis, and non-gonococcal urethritis and vulvovaginitis may be as a causative factor of the formation of infertility in human population. And that's why this group of diseases is very important, and this group is included in the group of important group of diseases such as the important strategy planning of the government of these countries. And the diseases which we can include in the group of the venereal diseases are 5. The first is syphilis, second is gonorrhea, and the synonym of gonorrhea is triper. But triper is German word of this. It's not slang, but this is the German word of the gonorrhea. Then third is ulcus mole. the third name of this disease, and then the name of the third disease, and the fourth and fifth venereal diseases. The name are fourth and fifth venereal diseases. And that's why at this moment we know 5 diseases which we can include in the group of venereal diseases. Then, why these diseases is so important? The first disease, syphilis. Syphilis, this disease, it's very interesting disease because a lot of clinical signs of this disease are similar to the clinical signs of other diseases. First, why this disease is important? First, congenital form of syphilis. Congenital form is a form of this disease which we register in newborn whose mother was ill by the syphilis. And this disease, it's possible transmission of this disease from the mother and penetration of the Treponema pallidum, which is the etiological agent of this disease, into the organism of the child, and then formation of congenital form of this disease. That's why the first important moment of this disease is possible formation of congenital form of syphilis. You can see the congenital form of this disease, which may be early and late. Early, when you can register the clinical signs at the age up to 5-year-olds, and late, when, as a rule, you can register the clinical signs of this disease in the age nearly 20 or 40-year-olds. And in this situation is very dangerous because at the onset of the life of person, it's impossible to find any clinical signs of this disease, and you can find these clinical signs only in this age. And sometimes it's very tragic for the family, and you understand this important moment. About what clinical signs you can register in newborn. You can see these clinical signs. Congenital form of this disease. The name of this situation is pemphigus syphilitica. Pemphigus, I am sure that you know this disease. This disease is characterized by possible formation of multiple blisters on the surface of the skin or bulla on the skin, and according to the analogy to the pemphigus, the name of this situation is pemphigus syphilitica, because the genesis of formation of this disease is syphilis, and that's why the name is pemphigus syphilitica. What can you find? You can find multiple blisters on the surface. After the opening of these blisters, you can find multiple erosions, and on the surface of these erosions, you can find multiple Treponema pallidum as an etiological agent of this disease. That's why it's the situation or condition of possible transmission of this disease by social way, not sexual intercourse, but social way, and this is very dangerous situation because possible transmission from one newborn to the other newborn by the social way. Next, you can see the different clinical signs, such as multiple morphological elements on the surface. You can see multiple papules, you can see multiple roseolas on the surface, and you can see that the extremities are in situation of immovement. Why? Because the name of this situation is pseudo-paralysis. Paralysis, you know from the chair of neurology, is a situation with when the extremities are without movement. And but this condition is in direct relation with change in central nervous system, and this is true paralysis. But in this situation is false paralysis or pseudo paralysis. Why? Because this movement of extremities is in relation with multiple fractures of the extremities. And that's why you can see these elements of fracturing of the extremities, and this is the basis of the formation of this condition, such as pseudo or false paralysis in newborn. And this is the movement of the extremities is very painful, and this is specific clinical signs of this condition. That's why next clinical case, the similar congenital form of syphilis, you can see the destruction of the bone structures in this situation, and the next, the similar congenital form of syphilis, you can see these multiple elements, multiple elements of the structure of the different anatomical structures of the human organism, and all of these clinical signs are the result of the syphilitic infection in the organism. That's why, first conclusion, why this disease is dangerous, because it's possible formation of congenital form of this disease. Second moment, possible involvement of inner organs, of involvement of internal organs in the duration of this disease. And predominantly, you can find involvement of heart, involvement of blood vessels, and if you know the disease, and the name of this disease is aneurysma aortae, in nearly 25% of cases, the basis of the formation of aorta, of aneurysm of aorta is syphilitic infection. And who will work in cardiology, cardiosurgery, don't forget about this possibility. That patient with aneurysma aorta needs in additional laboratory investigation for the determination of possible presentation of syphilis in these organisms. Next, third, possible involvement of nervous tissue and formation of neurosyphilis. About the neurosyphilis, formation of neurosyphilis may be by two ways. First way is the involvement of the nervous tissue directly in this process, or maybe involvement of blood vessels of nervous system. In first situation, the name is neurosyphilis parenchymatosa, because we can translate parenchyma from Latin such as tissue or nervous tissue involvement. On second variant is neurosyphilis mesenchymatosa. Mesenchyma is the blood vessels which are the one of the part of nervous system, and that's why possible involvement of blood vessels and formation of second form of neurosyphilis, such as neurosyphilis mesenchymatosa, or you know two possible forms: neurosyphilis parenchymatosa, involvement of tissue, in neurosyphilis mesenchymatosa, involvement of blood vessels. Next moment is possible involvement of brain and structures of brains in this process, and problems in psychiatry or in mental status of patient, and this is very important for the future psychiatrician students, because it's possible presentation of the patient with the problem of syphilitic genesis, and don't forget about this possibility. Percent is nearly 1% of psychic disorders in organism, maybe in mental disorders of the organism, maybe in relation with presentation of syphilis. And don't forget about this possibility. Next, this disease is transmissible disease. It's possible involvement of internal organs, nervous system, involvement of other parts of the human body. Then it's possible formation of congenital form of this disease. After this information, what is the etiological agent of this disease? This disease belongs to infection diseases. And etiological agent is an anaerobic microorganism, and name of this microorganism is Treponema pallidum. We can translate Treponema because we can include this microorganism in the group of Treponemas, and pallidum such as pale, because the cell walls of this element, this microorganism, is pale under the microscopic investigation, and that's why the name is Treponema pallidum or Treponema pale. Next, the way of transmission of this microorganism. The question, what ways from one person to the other person and in organism of the infected host. In the organism of infected host, the possible transmission of Treponema pallidum. We know these ways. First is neurogenic way. You know about this possible way. After the penetration into the dermis, then penetration into the receptors, and you know that from the receptors you can register the beginning of different ways and direction of these ways to the central nervous system, and that's why the first way is neurogenic way. Possible transmission in organism by the lymphogenic way, and third is hematogenic way. But this is very important because I must explain you later the possible dissemination of this organism, of this microorganism in infected organism, and that's why knowledge of these ways is very important for us. First is neurogenic and formation of neurosyphilis parenchymatosum. Second is lymphogenic, and I explain why this way is important. And third is hematogenic, or by the way. But you understand that the dissemination in organism by the blood at the onset of this disease is impossible. At the initial stage of this disease is impossible. Why? Because blood is enriched by the oxygen, and this microorganism is anaerobic microorganism, and that's why this way is impossible at the initial stage of this disease. Next, possible transmission from one person to the other person. We know four principally important ways. First is sexual intercourse. But don't forget that the necessary rule for the formation of this disease is penetration of Treponema pallidum into the microorganism. Without this penetration, we don't wait the formation of this disease. The important rule and necessary rule is penetration of microorganism into the microorganism, microorganism into the microorganism. And this moment is very important because sometimes it may be very surprising for us that it's you cannot find the syphilis in the wife because you can find the syphilis in the husband, and you cannot find the syphilis in wife, because we can explain that in this situation had not penetrated of Treponema pallidum in the organism, and we can explain why the syphilis isn't presented in this situation. The necessary rule is penetration of Treponema pallidum. Second is by the blood transfusion. And don't forget about this way of transmission of this disease, who will work in surgery, urgent gynecology, reanimatology. Don't forget that we know a few diseases which may transmit it from one person to the other person by the blood transfusion. We can include in this group syphilis, HIV disease, malaria, and few other diseases, and don't forget about this way. Third possible transmission by placenta, and then next formation of the congenital form of syphilis, and don't forget that in the pregnancy, the pregnant woman needs in the laboratory investigation twice in the period of pregnancy. In the first half of the pregnancy and in second half of the pregnancy. Don't forget about this rule. Twice examination. Sometimes, and in very high incidence of this disease, maybe 3 examination of the pregnant woman, because by this way we want to prevent of the formation of congenital form of syphilis. I am sure that who will work in the future in your countries, this rule will be necessary and very important. Twice examination in the first and in second half of pregnancy. Fourth way, it's very rare, but we must inform you about this possible way, and this way is social way of transmission of this disease. Now about the clinical signs of this disease. Clinical signs of this disease are different, and this differentiation in the direct relation with the duration of this disease. In your textbooks, the classification in our country is different from the classification in your countries. In our country is incubation period, first, second, and third stage in the duration of syphilis. In your country, incubation period and early form up to 2-year duration, and late form of syphilis more than 2 years of duration. And now I explain you according of the classification in your country. Incubation period. What is the period? Incubation period is the time after the penetration up to the clinical signs of this disease. And in this period, it's absolutely impossible to find any clinical signs of this disease, because this is a period of mobilization, of multiplication of Treponema pallidum, and then at the last period of the period of incubation, you can find the beginning or onset of the process of inflammation. But you can imagine that your patient in the period of incubation, if he or she had sexual intercourse in the past. And don't forget, very helpful in the confirmation of diagnosis is the investigation of sexual contact, sexual partner. And don't forget that this is very useful, very helpful in the confirmation of diagnosis. Who will work in venerology, who will work in gynecology, in urology. Don't forget that you can, very often, you can confirm the diagnosis by the investigation of the sexual partner, and don't forget about this possibility. But in the incubation period, you cannot find any clinical signs on the skin or membranes, only by the data of anamnesis. That's why we can conclude the laboratory investigation is not helpful, is not useful in this period, because the result will be negative. And don't forget about this very interesting moment. The early period, and what is the first clinical signs of this disease? Formation of element, and the name of this element is ulcus durum or chancre. What is the element? This element, we weigh the formation of this element in the area of penetration of Treponema pallidum. In the area of penetration of Treponema pallidum, we weigh formation of this element. Now, I present you the characteristic of this element. Why the name chancre? Because we can translate chancre from French, such as ulcer. Ulcer, because you can find the ulcer or erosion. You know that erosion is superficial defect and ulcer is deep defect. You can see the element, and if we present you information that the principally important way of the dissemination, of transmission of this disease is sexual intercourse, we weigh of formation of this element in the area of sexual intercourse. And we weigh predominantly in genital area. You can see this element or ulcer or erosion. The form of this element may be round or oval. You can